Okay, so I'm standing out of the patient room. I'm looking for some precaution, isolation precaution. I don't see any, so I'm gonna knock the door and I'm knock, and I'm gonna walk in. Hi, good morning. How are we doing?
Very good, thank you. How are you?
Good. My name is Lorenzo. I'm a Broward student, and I'm gonna be assisting you today with an assessment head to toes. Is that okay?
Yes. Okay.
So it's gonna take around from 15 to 20 minutes. So do you wanna use the bathroom?
No, I'm fine.
Okay, thank you. So next steps, I'm gonna wash my hands, I'm gonna put some gloves on, and I'm just gonna ask the patient what is the name. What's your name?
Alejandro,
And date of birth?
1010.
Can I confirm that, please? Okay, yes. So do you know who is the president of the United States?
Donald Trump,
Do you know which month are we?
May.
Do you know where are you?
We are in the hospital.
Okay, good. So the patient is awake, alert, and conscious +3. Do you have any allergies?
No,
Do you have any type of pain?
no.
Okay, so the patient is good. Okay, so we're gonna start the assessment. Do you mind if I touch you?
No.
Okay, so first thing we're gonna do is we're gonna start to palpate the skull. Yes, so we're gonna be looking for pediculosis, alopecia, hair density, distributions, right? So if they have any type of lesions, right? And according with my assessment, I don't see any anomaly in the skull, which means the skull is gonna be intact. Okay, moving on, we're gonna really check cranial nerve number 1 olfactory, right? Have you had any surgery?
No.
Do you have any problem breathing?
No.
Respiration?
No.
Okay, can you please close your eye and just tell me what is the smell of this?
Alcohol.
Okay, can you please the other one?
Vanilla.
Okay, so you can open your eyes. I'm gonna be looking here for some drains. Yes, some drains, hair distribution. Yes, so I don't see any anomaly actually, which means cranial nerve number 1 olfactory is intact. Moving on, we're gonna check cranial nerve number 2 optic. Do you wear any glasses?
No.
Do you wear contact lens?
No.
Have you had any eye surgery?
No.
Okay, can you please look over there to that sign and just read for me?
Exit.
Can you please read my budget?
Broward College.
Okay, good. I'm gonna check the pupil. Yes, in an adult normally have to be between 2 and 4. You have 3 millimeter, which is good. Okay, can I just open your eyes? I'm gonna check for the sclera, which is white, and the conjunctiva is pink and moist, which means cranial nerve number 2 is intact. We're gonna keep checking cranial nerve number 3, ocular motor, right? Do you mind if I just look to your eyes with the light? Yes. So I can see the pupil contracted, right? Okay, good. Let's check. Okay, very good. So I don't see, so it's very equal. Yes, there is regularity, so which means the perla pupil are equal, rounded, reactive to light and accommodation. So they are intact, okay? So moving on, can you please look to this pane, yes? And just follow without move your head. So not move your head, just follow, 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 and out. Okay, very good. Convergent is good. I need to you please change your down a little bit and just follow with me, please. Ocular center, ocular center, abducent, ocular, abducent, ocular, ocular trochlear center, ocular trochlear center. Which means cranial nerve number 3 ocular, cranial nerve number 4 trochlear, cranial nerve number 6 abducens are intact. Okay, moving on, we're gonna check cranial nerve number 5 right? We're gonna look for for symmetry, right? There is really symmetry. We're gonna look for hair distribution in the eyelashes and eyebrow, right? So can you please close your eyes? We're going to actually palpate, right? Forehead. We're gonna palpate sinus. Do you have any discomfort?
No.
No? Okay, good. Do you have any problem with mastication?
No.
No, we're gonna just temporal, we're gonna just temporal mandibular joint, open for me. Okay, close, very good. And now can you please close your eyes? And just tell me which part of your face I touch you.
Left chin. Forehead. Chin. Right chin.
Okay, very good. Can you just put a smile for me? Can you please lift your eyebrow? Okay, very good. Can you put your cheek? Okay, very good. Which means cranial nerve number 5, trigeminal, and cranial nerve number 7, facial, are intact. Okay, moving on, we're gonna check cranial nerve number 8, the acoustic one. Yes, so we're gonna make sure that we actually palpate. We're gonna look for symmetry of the ears, right? We're gonna palpate the back of the ear, looking for some drainage, right? We're gonna also check that there is no any damage, there is no any bleeding, right? There is no excess of serum. Yes, okay, very good. Now, do you have any problem hearing?
No.
No, do you have any hearing AD?
No.
No? Okay, very good. Now I'm gonna place on the here on the back, you're gonna close one of your ears and just repeat what I say.
Strawberry.
Can you do repeat exactly the same with the other side?
22.
Okay, very good. So cranial nerve number 8, acoustic, is intact. Okay, moving on, we're gonna check cranial nerve number 9, which is the glossopharynx. We're gonna check cranial nerve number 10, the vagus, and we're gonna check cranial nerve number 12, hypoglossal. Yes, we're gonna really make sure that we assess, we looked, hard palate look okay, soft palate look okay, there is no any cavity, gums look healthy, there is no any sign of infection. Yes, can you please say swallow for me? Can you please say hi? Okay, let me see. Okay, very good. Can you please your tongue out? Look to the side. Let me see. Up. Yes, so the frenum is there, which means cranial nerve number 9, glossopharynx, cranial nerve number 10, vagus, and cranial nerve number 12, hypoglossal, are intact. So we're gonna continue assessing cranial nerve number 11, spinal accessory, okay? So do you mind if I touch you? If you just, okay, so the skin can look fine to me, okay? Can you split? Now I'm gonna push my hands on your shoulder. Can you just push up? Okay, good, very good. Okay, now I'm gonna put my hands on your face. Can you please push? Okay, the other one. Okay, very good. Can you push up? Hyperextension, up, good. Down, flexion to your right shoulder, flexion to the left shoulder, flexion, rotation to the right, good. Rotation to the left, okay, good. So cranial nerve 11 is intact. So moving on, we're gonna move to the neck. We're gonna really inspect any area. We're gonna inspect the area, right? We're gonna be looking for some nodes, some lesions, some moles, okay, right? So we also gonna be, I'm gonna to palpate, yes, your, we're gonna be actually looking for any sign of GVD, right? Can you please lay flat for me? Okay, good. here. Can you please turn your head away from me? Okay, this way. Other side. Yeah, so I actually don't listen any type of weird sounds, right? So, which means the neck is intact. So we're gonna move with the thorax, yes, so we're gonna really make sure that we inspect any time of lesion, any time of edema, we also lumps and moles, okay? So let's see, let me check here, let me palpate here. Okay, very good. Now we're gonna scout, yes, with the stethoscope. Okay, so we're gonna have the vesicular, bronchovesicular, 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 vesicular, vesicular. Okay, very good. Can you please move to the back? This way, over here. Okay, very good. Stay there. Okay, so we're gonna just bronchovesicular, 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 vesicular, 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 and vesicular. Okay, so I did not find any sign of lumps, lesions, edema, and mole. Yes, so I didn't find any anomaly in the sounds of the lungs, right? I didn't hear any kind of ruse and things like that. So okay, so can you please stand up for me? Can you please turn around? Okay, I'm gonna place both of my hands on his lung and I'm gonna really ask him to breathe in, out, deep breathe in and out. Okay, so both hands are equal, so good chest expansion. Can you please sit? And now we're gonna do the AP diameter. Yes, so one hand on the chest, other one in the back, right? And it had to be, no, don't move. I'm gonna do it, thank you. And it had to be less the half of the transfer of the chest. Yes, so the thorax is intact. Okay, moving on, we're gonna check the heart, right? Okay, so we're gonna really make sure that we palpate the aorta, which is in the right of intercostal border, second intercostal space, down S2 is louder. We're gonna move to the pulmonary, left of intercostal space, border, second intercostal space, down S2, louder. The air point, left of intercostal border, third intercostal space, lock down, S1, S2 are equal. Triacuspid, left of intercostal border, fourth intercostal space, lock S2, louder. And the mitral, left of intercostal border, mid-clavicular, under the nipple, 5 intercostal space, this one louder, and is actually the apical, the maximum impulse, and is actually the apical pulse is in his full. And we're gonna be here this for 1 minute. Okay, moving on, we're gonna start to assess the abdomen, right? Do you mind if you just pull your shirt up? Okay, so there is no any sphere, there is no any lesion, there is no any edema, so it looks fine to me. Okay, so next thing we're gonna do is we're gonna check the 4 quadrants. Yes, we're gonna listen for 1 minute. Can you please play back for me? Thank you. Okay. So we're gonna start for the left lower. It's kind of like just follow the colon. Yes. Okay, so we're gonna listen. We're gonna listen for 1 minute. If we can hear any sounds, Paul, what we're gonna do is we're gonna hear for 5 minutes. A normal, a regular sound, it should be between 5 and 35. I have a question for you. Do you have any? Sign of nauseous?
No.
No? Do you eat regular?
Yes.
Like, are you hungry?
No.
Like, regular? No? You good?
Yes.
Okay. Okay, good. So yeah, so the stomach is intact. Okay, I'm going to palpate. Any discomfort?
No.
No? Any heartburn? Reflux?
No.
Any problem with urination?
No.
Okay, so the abdomen is good. Okay, now we're gonna check the upper extremity. Okay, so we're gonna just, can you please follow me? Abduction, pronation, supination, flexion, extension, and contraction. Okay, very good. Can you please, we're gonna just check the papillary refill, which is good, and they are under 2 seconds. I'm gonna check also the temperature, right? The temperature, good skin color. I don't see any lesion. I don't see any mole. Okay, good. I'm gonna just your brachial pulse. Very good. It's very strong. In the radio. Okay, can you please close your eye for me and just tell me what I'm touching?
Left arm. Right arm.
Okay, very good. So, which means we were checking circulation, mobility, and sensation, and also range of motions in the upper extremity they are intact. Okay, so we're gonna check for the lower extremity, right? We're gonna make sure, same thing, lesions, edema, any type of mole. Do you have any type of pain?
No.
No. Discomfort?
No.
No? Okay, very good. So now we're gonna really start to assess the pulse, right? So we have the here. So we have the femorals, right? So we have the popliteal here. We have the dorsalis, and we have the tibialis. Yes. So his upper. Okay, can you please close your eyes? We're gonna check for sensation.
left leg, right calf,
Okay, very good. So his lower extremity mobility and sensibilities are intact. Okay, and I'm gonna ask my patient if they can really stand up. If they only can stand up, yes, I'm gonna ask my patient to stand up, please. I'm gonna ask them to turn around, right? So we're gonna palpate the vertebral column. Yeah. Okay. Make sure, do you have any discomfort?
no,
Any pain?
no,
Okay. And now, after this, we're gonna really shake the anus, make sure there is no any bleeding, hemorrhoid, or any lesions. Yes, and with this part of the assessment, we are done, which is so we conclude the patient Alejandro is intact, or he have a really good health.